have one neurologist in Europe have to take care roughly of 15,000 patients. And you can see in this, it's very small, but we have an average 10 neurological inpatient facility per country. So it's impossible, really impossible to take care of all these patients. And you see here more detailed the presence of neurologists, or how many people with the neurology. You see that the poorest are UK and Ireland, and the richest one with the neurologists are Georgia, Latvia, and Lithuania. So really a big issue. So how can you reduce this burden? So we need to understand what is this brain health and what are the factors that are important in this area. We need really to get together in this issue. We need to have money for mobilizing people, and we can't say, I go for dementia, I go for one disease. Really, we have to think broader. Also because we know that several neurological diseases have the same pathophysiological mechanism. So we have to take it in a whole, the whole package, the whole brain. And as I said, we have to really start talking about prevention, because in this way we can reduce people who will develop neurological disorder. And be aware of that. But not only us, the physician, the family doctor, patients, the family of the patient living with neurological disorder in Europe, everywhere. So this is the reason why you will see around that there are several associations and several stakeholders talking about the brain health mission. But especially for DIN, we developed this brain health mission, which is really a collaborative initiative, together with all the stakeholders that they want to work with this. And so far, we have collected 26 strategic partners. So what is brain health? So we took the World Health Association, WHO definition, in which is a state in which every individual can realize their own abilities and optimize their cognitive, emotional, psychological, and behavioral function to cope with the life situation. So we have mental diseases and neurological diseases together in this brain health, according to the WHO. Of course, as a neurologist, we are still more interested in really the brain, organic part of the mental health. So we have several initiatives that we have to put inside, and we will go through some of them. So to build up this mission, what we want, as DIN does, reduce the burden of neurological disorder, really we have to be global, right? To have to stimulate everybody, a part of the initiative that other people are doing. We are not, as I said, the only one, but especially to help each neurological association, each country, to build inside their country this brain health. So the WHO has asked us to do so in the IGAP plan, but also in the IGAP plan there is the brain health. So we really have to stress. So what we are doing is to share and to try to help every country who, that has not developed yet a plan, like Switzerland, Italy, Norway, they have already a plan. All the other countries, they're still waiting. And I think the role of the neurological community is important to address, as I said, the Ministry of Health, the education, to finances to get inside. And for also, as a neurologist, we need more research. We need to educate people, what does it mean, and all the public to get inside. As Professor Boone liked to cite, when we teach children to brush the teeth, right, to prevent pathologies of the teeth, we should do the same, to teach them how to keep a very good brain health. So we need really a public awareness. So we have developed several activities. This is a summit every year that we organize with the purpose really to put everything in the loop. but also during the Congress. Last year we had several activities, this year even more for that. And as I said, we really want to implement and to help the national society, the countries, to have their own plan and strategy. Then we have some school challenges in Austria. We have Professor Berger here, who developed this in Vienna, and also in Finland. Our colleagues in Finland, they were very successful last year, and they're doing the same this year as well. There is, what I mentioned before, a special training. We have 1 year advocacy training to teach neurology how to address, as I said before, politician and the patient for this, and not only for this. And we have podcasts with some research projects, the website that I will mention before, and we really want everybody, as I said before, to be in the loop. Just a scoop what we did last year. So, you know, the European Parliament, every 6 months, we changed the presidency. In Belgium, there was in May the presidency, so we went there and we met also the Queen. We try really to stimulate Belgian people to have this concept, to be aware, and to start doing plans in this way. There is the United Nations Summit, so we put brain health, neuroscience in their agenda, and Professor Leonardi was there, together with the WHO, with the European Brain Council, to really make politicians and the other people aware that without a brain, there is no health, basically. There is a special forum in Europe where the Ministry of Health and their people, they go there to discuss the economy challenges in health. And we went there as well because you know very well that the oncologists, cardiologists, they get all the attention, but the neurology, we are too kind, we are nice. So we don't raise our voice, so nobody here, nobody knows about us. And also in Italy, there was the G7, the Ministry of Health meeting. We put in their agenda, we tried to put in their agenda, again, neurological problems, brain health. And we wrote a booklet that they read, and during the G7 meeting, we've been there, again, with the president of the Italian Neurological Society, the Ministry of Health of Italy, and they have already a plan. So we ask also to share with all the other countries because there are already some plans. Of course, we have to adapt to the country where you live. But just to say that there are other countries that are already quite advanced, and also, as I said before, try to make it practical. What does it mean, brain health, for a child? A boy, a girl, what does it mean? So in Vienna, for example, they try to build, asking the children, how can I explain, how does brain health mean for a boy of 10 years old, right? They understand the teeth. How can I make them understanding how can we preserve the brain health, right? This activity has been done, as I said, for example, in Vienna with Professor Berger, and I said there are some initiatives that really can be shared because it's been very successful. I mentioned already this training. We had 60 people participating last year. We opened again this year the participation. We had more than 300 applicants because it was so successful last year. So maybe next year, please, one of the Egyptian society can maybe apply, or two of you to try to get more with the hands-on. We just published this paper, and I invite you to read, in which we try to write and to apply our brain roadmap for the brain health in Europe, how we can move, what the EAN, as I was speaking up to today, can do and disseminate for this important area. But again, it's not us alone talking from the podium. We really need, together with the hands and our brain, we are 45,000 neurologists in Europe, 45,000 brains that can really change the curve of this augmentation of burden of neurological disorder. So, as I said, Belgium, Italy, now we will be in Poland. The G7, the presidency of the European Commission is, Parliament is in Poland. We will go to Warsaw with the same idea, not to push a bit the Ministry of Health in teaching and research to listen to the brain issues. So the G7 will be in Canada this year. So we met also with the WFN and with the WHO a few days ago in London, Ontario, to try to put in the agenda of the Ministry of Health, again, the brain health. So we want really to be strong in telling that we have to save the brain, otherwise there is no future. They have to commit to give some money to do so. And as I said, really have a broad picture together. The borders, they exist for, for politicians, but not for COVID, for example. It was everywhere. And also the brain disorders are everywhere. So we can't just, think in a small corner. We really need to think globally for the brain health of everybody in the world. But we start from our small area. We start from here. We start from Cairo, from Alexandra. We start from where we live with this idea. So this is why it's a call for everybody, for myself, for you, to be involved in the prevention, right? So in this nice picture, you have very basic prevention areas like sleep well, eating well, exercising, which is everybody can do, basically. Then you see in the protection we need some more help. And again, in the plan, we need really the government can help us to act, right? So there's something that have to be taken together. So there is if you go to the website, you will find a lot of material and also what we have done up to last year. So if you are curious to see how I can do, so we can always help to better understand it. We have statistics, summaries, and as I said, we will have other activities this year and also in Helsinki quite a lot. And you see, is my last slide, I think, the partners so far, that we have the Headache Society, the Stroke Society, patients involved, and also some drug company, because really we need everybody, not just in our corner. So thank you very much. I hope that I've been, also if there is a question, some question on the time. And I hope really that I urge you to do something together for our brain, for our future. So thank you very much.